We want to make sure that nurses have opportunities both in our local communities as well as international communities to engage in courageous dialogue with others who may think or look different than we do and whose culture or language may also be different. The difference is what brings us together and allows us to have more of this tapestry of what we are about, ensuring that we advance health for all and that we move forward together.
You're listening to the ONS podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between.
Hello and welcome to the ONS podcast. I'm your host, Darcy Burbage, chair of the ONS 50th Anniversary Committee. The World Health Organization predicts that by 2030, more than 70% of the world's total new cases of cancer will occur in Africa, Asia, and Central and South America, illustrating the need for ONS members to stay involved globally and target educational efforts where they are needed most. This episode will highlight how oncology nurses contribute to international partnerships, knowledge exchange, and advocacy efforts that enhance cancer care worldwide. This episode is part of our 50th anniversary podcast series. Please join us monthly throughout 2025 as we feature episodes exploring ONS's rich history and promising future. Joining us today are three of our colleagues who each have extensive experience working with oncology nurses across the globe. Dr. Kristin Ferguson is the Senior Director of Strategic Operations, Bone Marrow Transplant and Cellular Therapies at MedStar Georgetown University Hospital. Kristin is a member of the ONS Global Volunteer Team, where she's presented on a variety of topics for oncology nurses. She is also active with the Health Volunteers Overseas program. Dr. Ashley Leak-Bryant is a professor and senior associate dean for the Office of Strategy and Global Affairs at UNC Chapel Hill School of Nursing, where she currently leads the Oncology Nursing Fellowship Program in the School of Nursing and has led nursing efforts in Malawi with UNC Project Malawi. She also co-directs the Pan American Health Organization, World Health Organization Collaborating Center in Nursing and Midwifery with a focus in quality and safety education. And Dr. Erica Fischer-Cartlidge is the Chief Clinical Officer of the Oncology Nursing Society, where one of her many responsibilities is to oversee the ONS Global Initiatives Program. Ashley, can you share a bit about your background and what sparked your interest in international oncology nursing collaboration?
Thank you so much, Darcy, and thank you to ONS for the invitation to share more about the international and global collaborations. First, let me just say, my first experience was when I was 21 years old. This was when I was in nursing school at UNC Greensboro, and an opportunity came about where I had a chance to go to Honduras, and it was for a 1-week service learning cultural immersion experience. And that really gave me my first entree into global health as well as global training. And so as a first generation college graduate who have never been out of North Carolina, nor had ever flown, it was really an eye-opening experience that has led me now to my current role and passion for global health. I would say also, as I continue to move through my educational experiences, for my master's degree, there was another opportunity that came up and I had a chance to go to Russia. And I was there in Russia for 2 weeks. And I was really interested in looking at the nurse and healthcare systems and how care was being delivered to individuals and families in their home setting. And then lastly, I had a chance to go to Guatemala during my PhD program. That was one experience I'll never forget because we were there, my colleague and I were there with pre-licensure students as well as graduate students, and then we were PhD students. So it was great to be able to learn, share, coach, and mentor nurses and nursing students very interested in how to care for individuals outside of the bounds of the U.S. So I would say my experiences into international oncology nursing collaborations really started at the age of 21 and have continued on based on experiences that I've had through ongoing education and being able then to disseminate or share that work widely with others, both publicly, but also through journals.
Wow, that's amazing. What a full circle moment, starting when you were in nursing school and then taking nursing students back, and how much you've shared with others through your experiences internationally. Thank you, Ashley. Kristin.
Thanks, Darcy. And thanks to the ONS team for inviting me to talk about my experiences. Global health is definitely near and dear to my heart. I would say, similar to Ashley, I first became very interested in global health during my bachelor's program at Boston College. I spent a week in Managua, Nicaragua, doing part of my community health rotation for my BSN. With a few other nursing students, I would practice taking medical histories in Spanish, doing vital signs, recording different things for a clinic that was serving people in the city without a lot of access to healthcare. In that trip, nurse practitioner students from Boston College also attended. I had always had a strong interest in travel and in international relations. I would actually say from a very young age, because both of my parents served in the military. So one of my fun facts, my only fun fact that I will tell people is that I went to 8 elementary schools across 4 or 5 different areas. I started in Germany and then continued on to Texas, Hawaii, and Virginia. And so from a young age, different cultures sparked my interest. And then nursing allowed me to pursue that further. I also, like Ashley, I had another opportunity during my master's program to intern at the Ministry of Health in Belmopan, Belize, where I analyzed data on maternal and child health. And so that experience combined with the other experience helped to stimulate my interest in global health.
Wow. Both of you have had quite an extensive background starting in nursing school and just continued that passion on. Thank you both for all that you're doing. Ashley, we'll get back to you. Tell us a little bit, if you can, about your work in Malawi and how ONS has supported the work that you do there.
This is also another full circle moment, as Kristin has alluded to in her experiences. In 2018, we had the Malawian delegation come to UNC Chapel Hill. So University of North Carolina at Chapel Hill has one of the longest standing collaborations with Malawi, and we call it UNC Project Malawi, and it has been in existence for more than 30 years. It's pretty powerful, and you can go online and look at uncprojectmalawi.com for additional information. But it was really that experience that they came here, and those nurses and other allied health professionals came to UNC, to our cancer center, to see how we were making sure that we were engaged in best practices, and then how they would be able to take that back to Malawi to make sure that they have what they need as they were opening up a new national cancer center in Malawi. Shortly thereafter, December of 2018, my dean at that time, as well as my colleague, Lishan Song, we had the opportunity to travel for a week to Malawi. And it was really an opportunity for us to do a need assessment. And so we had a chance to meet with several key interested parties, including the Ministry of Health and Wellness, their nurse leaders, chief nurse officers, nurse managers. We heard from both patients and guardians. And we really heard from the community of what the needs were in that area, particularly Lilongwe, which is the capital of Malawi. We wanted to make sure that we were really meeting the needs of the individuals. And so it was really during that time we had really good conversations with them, understood what their needs were, and then co-created, co-developed a plan with them of what next steps would be. And so from that need assessment came the need for nurses to have an opportunity to better understand what is cancer, what are the different treatment modalities of cancer, how do I talk to someone related to someone being diagnosed with cancer, and symptom management. At that time, Jen Hotchkiss and I, Leishan Song, we worked closely together with our colleagues in Malawi, Dr. Shafundo Zimba and Dr. Agatha Bulla and Bingo and Tico, to really work together. And that's the key theme there, collaboration from both our side and their side, co-create virtual webinars to meet the needs of their nurses. And so those virtual webinars were held every 2 weeks for really a 4-week span. We did a pre-test to see what their knowledge was related to some of the content areas. We then actually delivered an educational intervention, and then we did a post-test. And what we did find was over time that their knowledge increased about cancer, symptom management, and so forth. And so we were really, really proud of the work that we've been able to do. Also, just want to talk about the work we've done also related to grand rounds, so virtual grand rounds. It was important for them to bring different patient or family situations to us, and we would discuss that as a team. I have my ethnocentric view of what we would do here in the States, but they have very limited resources or equipment to be able to do some of those same things. So we thought about what other strategies or techniques could they use to address the needs of the Malawian patient and guardian and individual. And it's just been ongoing work that we've been engaged in. And we've presented our work both through papers and through different support groups. So that's the ongoing work that we've been able to engage in with Malawi. And that's been since 2018 until now.
Wow. So for 7 years, that's amazing, Ashley. And I was writing notes as you were talking. And what I think is so important is that the collaborative effort in working together. So it wasn't like somebody coming in from another country and telling them what they should do. It was working together to find out what is done in their country and help supporting them with what needs that they have. So that's amazing. I love the grand rounds format that you were describing, which leads me to the next question. What are some other innovative lessons or unexpected lessons that you've learned by working with oncology nurses and students in Malawi or other countries that you have visited?
You know, there are a few things that come to mind, but I would say it's always important to make sure you understand the need of that community. In the U.S., we know what our top 4 cancers are. Those top 4 cancers as of 2025 look very different than what it is in Malawi. In the U.S., it's the breast and the prostate, the lung, and colorectal. Well, those are so different than what they are in Malawi. In Malawi, it's esophageal cancer, it's cervical cancer, it's Kaposi sarcoma, it's lymphoma. Just imagine as the team and I were able to develop educational materials based on what we think the top 4 needs are of that country, we really will be going down a rabbit hole. And so the key lesson is making sure you really do your homework. You really engage and collaborate, really look at the statistics, go online and see what are the common reasons for mortality, what are the estimated new cases, what are you starting to see an increase in? That is going to help guide the conversation and really make some really meaningful, impactful changes. The second piece of that would be, I think no matter where you go globally, you want to make sure that the images that you're using really reflect the individuals of that community. It's important that in Malawi, majority of the people there, I would say, are brown skin or darker skin. I think it's hard to have images of individuals who are not brown skin or dark skin, showing them images of what it may look like to have radiation therapy. So you have to be very mindful because you're coming in then with your own ethnocentric idea of what it could be or should be versus what's reality. So that's the second piece I would say is first, understand the needs of the community. Second, do your homework, know the statistics. And third, have your collaborators, your partners involved in every step of the process and remind yourself that they are the expert. You're still a guest in their home. You're still learning. The goal is to co-create and co-develop. So you're able to create this plan together that then one day, if your institutional organization steps away, they are able to continue to move this work forward. But I would say continuing to include them in all that you do from the inception. So from the very start of a project to the very end, allowing them to be the ones to present at conferences and be the first author on information that needs to be shared, and include them in everything that you do. Acknowledge the people that have allowed this to happen. That includes the Ministry of Health, that may include the nurse managers and others, but acknowledging is really, really important in this culture.
That is so important. I'm so glad that you brought that up, because even in our communities too, we really need to understand the needs of the communities that we are practicing in and be mindful and respectful. But I'm so glad that you mentioned that, especially when we're working internationally and globally, that we respect the individuals in that community. I love what you said. They are the experts and we are the guests. That's really impactful. Thank you, Ashley, for sharing that great words of wisdom with all of us. Kristin, can you tell us a little bit and talk with us about the type of oncology work that you've done in other countries and how ONS has supported this work?
My first time volunteering with ONS globally was in 2018 at a joint conference between ONS and ASCO in Manila, Philippines. I volunteered with another ONS member, oncology nurse Susan Weiss-Barend, and we presented a half-day educational conference on breast cancer to, I would say, about 50 oncology nurses from different parts of the Philippines. We had partnered with them several months prior to ask exactly what they wanted to learn, because like Ashley mentioned, you want to present and connect with them about content that is meaningful, about therapies that they're interested in, that they have access to. And so we created presentations and did lectures for them and allowed them to ask questions and connect with us. That conference was in partnership with ASCO. So we also participated in the medical conference, offering the nursing point of view to the physicians listening in on different other parts of the conference. In 2019, I did a similar conference in Tbilisi, Georgia. That was exciting because it was a new country and they wanted to learn different things about breast cancer and GYN cancers. Then when the pandemic came in 2020, I feel like we'll never stop saying that. But when the pandemic happened, virtual conferences and learning became the way that everyone connected globally for several years. I took advantage of that and looked for message boards and requests to speak virtually and do some teaching. And I did connect with a hospital in the Maldives and presented to a class of nursing students, which was very exciting. More recently, I have volunteered with ONS at the Asian Pacific Breast Cancer Summit, which was in Indonesia in 2024, and then a few months ago in Singapore. And this is an exciting conference because it draws in nurses from the region. So you end up having 5, 6, maybe 7 countries represented at these conferences where oncology nurses are very eager to learn, meet one another. And so the teaching that we've provided there has been a combination of lectures and then roundtables where we've strategically placed nurses attending with nurses that are not at their same hospital so that they can connect and share experiences with myself and another ONS member and maybe some other local staff acting as moderators and facilitating conversations. And then more recently, I have also been volunteering both in person and virtually with health volunteers overseas, as you mentioned, in the country of Vietnam. Currently, we're doing virtual education sessions for a hospital in Hue, which is located in central Vietnam, once a month. And typically, they will either send us a case study with a topic such as oral oncolytics or thyroid cancer that they would like more education on. And so we will make slides and then present that content and then allow time for questions. So a lot of good opportunities out there, especially through ONS.
And similar to what Ashley had said too, is providing the education for what they need. So when you leave the webinar or leave the country, that they're able to carry on with the information that you shared with them so they can provide the care to individuals in their community as well. Kristin, can you share with us, how do language, resources, or healthcare infrastructure differences affect collaborations?
I feel it's very important before you speak with a country, especially if you're going in person and you're presenting, to do a little bit of research ahead of time. It doesn't require a lot of time and you don't need to be an expert, but before you get there, having the opportunity to connect with the conference organizers about what they're expecting, so you're meeting their expectations, can be very helpful when planning presentations. And also understanding what common languages are spoken, what type of infrastructure their healthcare access is like for the common patient, can really help impact how you tailor your presentation and the education you create. I'll give an example. Just last week, I went to the ISNCC conference in Adelaide, Australia. ISNCC, for those that do not know, stands for the International Society for Nurses in Cancer Care. I presented on cellular therapy or tumor-infiltrating lymphocyte therapy for melanoma. It was a very well-attended presentation, but I did check ahead of time to see if the therapy I was discussing is available in Australia, and it currently is not, but it was accepted when I submitted an abstract for it. And so I was able to mention this in my presentation, which let the nurses listening know that I had done some research prior to presenting, and I was offering to help with policies or procedures or anything like that after my time presenting, if they wanted to take my contact information and connect with me in the future when that therapy is available in Australia. I will also say language is a very big factor when volunteering globally. And if you're going to a country or a conference where English is not going to be the primary language, making sure that you have translation services available is critical. ONS staff often are very involved in managing this with the hosting country or organization, which is very helpful. So it's definitely not all on the volunteer, but it can add a little excitement when you're volunteering. When I was in Tbilisi, Georgia in 2019, the people there, most of them do not speak English. And so they speak their native language, Georgian. As I presented, I was wearing a headset, and all of the oncology nurses in the audience were wearing a headset, and I was live translated. What this means is when you're speaking, a translator is sitting in a booth close by, and you can actually very quietly hear in your ear, he or she quietly translating what you're saying into the language that the nurses can understand. It's actually a bit funny because when you make a joke or ask a question expecting nods or head shakes, it takes several seconds for the translation to occur. You kind of get used to a 10-second delay, and you have to pause your speaking and allow actually a little bit more time in presenting if translation services are required.
That's an excellent point. Ashley, just to go back for a moment, with your work in Malawi, have you noticed that occurring as well? Are those built in, since there's been such a long history with UNC and the work in the Malawi project? Is English their primary language, or do you have that same barrier when you work with individuals in that community?
In Malawi, I would say the primary language is English. There's also different dialects, and Chichewa is what they typically speak in Malawi. I will say the other work that I'm engaged in, primarily in South America and Central America, when I'm at different conferences, they will have 3 or 4 different languages. So let's say someone is presenting in Spanish, and then they may have, depending on the participant, you could hear it in Portuguese, you can hear it in English, you can hear it in Italian. So I would say it really depends on the international conference and how thoughtful they have thought about, if you're having a large conference like that, to make sure that the resources are there and there's accessibility. Needs have been really thought through and addressed. But I would say in Malawi is primarily English, and we oftentimes use translators as well of that community.
I didn't even understand that language. I don't think I've heard that before. So that's also so important too, as
Yes.
you said, and Kristin too, about knowing your audience, knowing where you are going to present and doing your homework beforehand, just to make sure that you are sensitive to colleagues and individuals from different countries. And when you had mentioned about if you say a joke or something, making sure that's not going to be offensive too. So all of those things are really important when we do international global work with our colleagues as well. So as we're nearing the end of our episode, which I think we could go on forever, but I know we can't, I'd like to ask you both if you can share with us some personal reflections. Kristin, what aspect of your global oncology nursing work are you most proud of and why?
I agree. I think we could talk about this subject for a long time. I would say I'm most proud of being able to connect and provide educational resources to oncology nurses looking for assistance. Sometimes this happens while I'm volunteering or speaking at a conference, presenting education, but it does often happen afterwards in the form of a nurse reaching out by email or WhatsApp or LinkedIn, asking for an example of a policy or education on a specific topic. And this happens after I've made a connection with a nurse at a conference. I always encourage the nurses to stay in touch and keep my contact information handy. It's exciting to see, on Facebook, a lot of my friends on Facebook speak Georgian. So you see things like that. You see them traveling to the European Oncology Nursing Society conference. And it is really meaningful just to know, you've had that interaction with them at a specific time in your life, and you're able to see other people that have a passion for oncology nursing around the globe. So I would say I'm most proud of maintaining some of those connections, and it's been very professionally fulfilling.
Ashley, what has been an aha moment or experience that made you realize the true power of global oncology nursing collaborations?
When we think of global, I think we oftentimes think it's about going to another country or traveling, right? Getting on a plane. And I just want us just to remind ourselves that our local environment is also a global complex environment as well. And so at UNC Chapel Hill, I lead our Office of Strategy and Global Affairs. Also, we have our Office of Strategic Partnerships and Practice. And then we have AHEC, our Area Health Education Centers. And you may say, wow, these three offices, what's the connection? The connection is the Office of Strategic Partnerships and Practice really focuses on the local needs of individuals in North Carolina. So how are we making sure that the needs of these individuals are being managed appropriately? Then we have our global office. And so to me, both local and global, they work very closely together. And to me, you can't have one without having the other. Or how does one inform practice and policy change? And then the third is AHEC, which is really about how do we continue to make sure that nurses in particular have those continuing professional development opportunities to be their best self. I would say from this, I've learned that we want to make sure that nursing students have opportunities both in our local communities as well as national, international communities to engage in dialogue, courageous dialogue with others who may think or look different than we do and whose culture or language may also be different. I think the differences is what brings us together and allows us to have more of this tapestry of what we are about, working together, ensuring that we advance health for all, and that we are able to move forward together. I would say personally, that's what's been important to me, that I'm not taking the global opportunities away from the local community. It's we're learning together so we can become better care partners, better nurses in how we could communicate and how we work with the community, families, and the world around us. Thank you for having me and for allowing me to share this. And it's just the ongoing support of Oncology Nursing Society that allows this to happen. When we traveled to Malawi in December of 2018, we had probably 50 books, brand new books, from ONS Cancer Basics all the way to psychosocial support to whatever it was that Brenda Nevajan and her team supported the mission. Those in Malawi continue to use these resources as they think through how do we address these different needs of the community. So ONS, thank you for your ongoing support of the work and for this podcast to be able to share with the community about the awesome work of oncology nursing collaboration.
Thank you. And I love what you said about our local community is also a global community. I think people forget that sometimes. We live in, as you said, a tapestry. So we can't forget that everyone that we see comes with their own backgrounds and community backgrounds and where they live, they grew up, their culture. And I'm so glad that you had brought that up. And you are absolutely right. We need to move forward together, and we're all in this together. We do have one final question for you both. If you could, what advice would you give to an oncology nurse who may be interested in getting involved in international or global oncology work? Ashley, we'll start with you.
For those who will be listening to this, you may say, am I ready? I'm nervous. I'm scared. I don't know how this is going to turn out. But I would say, trust your gut. If you're even listening to this podcast, there's a reason why you're coming to this, right? So allow us to be, Kristin and myself and even Erica, Darcy, reach out to us and have really, I think, that one-on-one conversation as well, that we can provide you even more details. I would say it just opens up your mind. I think global opportunities allow you to have a growth mindset. It's a humbling experience. It grounds me and reminds me of why I chose nursing. And so I would encourage you to think about it. Write down any of your hesitations that you may have, and we can talk through those hesitations that you may have. But I would encourage you, if you're able to do this through educational experience, personal travel, through, service learning, immersion experiences, it would only deepen your capacity to be able to care for families, individuals, communities as we move through 2025 and beyond.
That's beautiful. Kristin.
It's hard to follow Ashley with her wonderful answer, but I will reiterate that, it can be scary at times if you're wondering if you have the right experience or knowledge to present. But if you have been working as an oncology nurse, you likely do have a lot to share. You will be doing, as I mentioned before, a little bit of homework before if you're presenting or volunteering to see how you can best add value to where you're traveling to. So if you're interested, look for opportunities posted through Oncology Nursing Society's website that come up periodically and apply. Other organizations sometimes have opportunities. Sometimes volunteering is funded, and sometimes you may have to consider using your own funds. And I will share, when I initially applied to volunteer globally with ONS, I think the first 2 or 3 times I was not selected. And that's most likely because other people applied and, there's only so many opportunities. But I didn't let that get me down. I think that failure is a wonderful thing. It's not really failure, but failure to get an opportunity. So if you're very interested, just keep trying, and eventually you will get an opportunity, and that might lead to another opportunity. That's how I've been able to maintain my global health experience while maintaining my full-time job here in Washington, D.C. I would say it's open to anybody who's willing to try. So keep trying. And like Ashley mentioned, please feel free to reach out to us if you want some guidance or some more information.
That was great. Both of you. Thank you so very much for sharing your experiences and your insights into global oncology nursing. I think it's clear that regardless of where we live or where we work, we all have the same passion for high quality cancer care and ensuring our oncology nursing colleagues are well versed in knowledge and that we do our homework. I want to leave with that just to make sure that we are responsive to our colleagues and the communities in which they live and work. So thank you both for joining us today. It was great.
Thank you so much.
Thank you.
Erica, what is the history of ONS's involvement in global partnerships? Can you share what types of global projects ONS has been involved with?
I'd have to say our work internationally goes back really to our roots 50 years ago. Pearl Moore was very active with the Union for International Cancer Control as a start. That UICC funded training programs across the world for nurses at that time. And then really over the years, our involvement has kind of morphed and changed to what the global needs have looked like. It's primarily focused on supporting nursing practice development in low and middle income countries. And we've done that a variety of ways. It could be site assessments and making recommendations for establishing practice standards. Some of them are education programs or providing resources for nurses in those countries. Some of the work we do is also by connecting our incredible members with sites in these countries to support their needs, and other programs we do in collaboration with organizations like City Cancer Challenge, ASCO, or Health Volunteers Overseas. And those really generally tend to take a multidisciplinary approach. And then one other way is we have also always had a role in mentoring new oncology nursing professional societies that are starting in those areas of the world.
Oh, that's great. I didn't realize all of that. So it's wonderful to hear that since the inception of ONS, it's always been involved in the global community. So that leads us to our next question. What role do professional organizations such as ONS play in advancing international oncology nursing efforts?
I think that the professional organization role is absolutely critical in how we advance global oncology. Certainly providing education and helping empower nurses to be more autonomous and equal partners on the care team is a big piece of that. But it's also through forming international partnerships and really elevating the collective voice of nurses in the specialty. This goes a long way in standardizing practices, promoting leadership development among oncology nurses really across the world. We know that nurses are not seen the same country to country to country in the healthcare team. And so a big part of what we do is try to elevate the importance of what nurses bring to cancer care. And some examples of what this looks like is together with the Canadian Oncology Nurses Association, or CANO, we've created position statements on fertility preservation in individuals with cancer. We meet routinely with 5 or 6 other organizations from across the world: CANO, the European Oncology Nursing Society, the International Society of Nurses in Cancer, or ISNCC, MASC, the Global Power of Oncology Nurses, Asian Oncology Nursing Society. We all come together and we talk about how we can collectively really enhance oncology nursing across the world. We have different healthcare models. We have different financial situations. Also, the organizations sometimes operate slightly differently. Some are organizations of other organizations. Some are organizations with individual members. But we all really talk about what are the synergies in what we're doing and how we can collectively have a bigger voice to advance nursing. We've put together recently a publication on how oncology nurses advance supportive care across the world. We've done some international presentations on the role of the oncology nurses globally together. And I think that's so important in kind of really thinking about how the profession is seen beyond just the United States boundaries. One thing I also think is just really important to mention is if you're listening to this and you're a member of ONS, you also are automatically a member of the International Society of Nurses in Cancer Care, ISNCC. By ONS being an organizational member, that extends membership to all of our individual members and the access to resources and opportunities that you have.
And it's so great to hear that. And especially as we see oncology nursing and the voice of oncology nursing being promoted globally, it's nice to know that ONS has that relationship and that we're, as members, also members of that organization as well. Which leads me to our next question, which along those lines, on the opposite end, however, what are some of the biggest challenges in cancer care that international partnerships help to address?
I think that one of the biggest things and where these partnerships are so essential is for improving outcomes and equity in cancer care. For us, these partnerships help bring all of the healthcare team to the table, which in countries where nurses still largely report to physicians or they may not have the same autonomy as in the US, that's going to be a critical factor for change. Beyond that, we're able to really help tackle global challenges such as limited access to trained professionals or medical resources by coming in and supporting that. Things like delays in diagnosis or treatment, inconsistent care standards. One effort that we really had the opportunity to be involved with is helping bring navigation services to South America. That program we supported with Spanish-speaking nurses through a partnership with City Cancer Challenge. And what's really unique and different about programs like that is that the countries have to actually apply for this support. They have to have a specific goal they want to achieve. They have to show that they have dedicated resources and aims. And then they go through very specific phases of work. It's not this kind of fly in one day, give them education and fly out. You're really kind of hand holding them through multiple phases of efforts. And I think when you have programs like that, it helps to minimize some of those challenges that we see, which are, how can you make an impact when you're only going in for a day or 2 days and providing education? Are you really going to reach the nurses? What will the sustainability of change be? And so I think that's the hardest part, is capacity and really seeing that sustained change happen in all of the programs. I think it's unique to some of the things that we do, where you're really able to say, you know what, in 5 years, we're going to know we were a part of the beginning of a change happening in this country.
That's so exciting to hear. I love that, especially the ongoing support to help with sustainability of change. I just love hearing that. So thank you for all of your work and our work at ONS. And as we both just came back from MASC, what do you hope the future holds for ONS and its international oncology nursing partnerships?
Oh, I have so many hopes. I think, I hope to see more opportunities come up for us to raise awareness of really this essential role and how we bring a greater spotlight to what nurses are doing across the world for patient care. I hope to see us have more collective global position statements in this space. I hope really to see that we have more unified projects across nursing organizations across the world, where we then really can bring our resources and our members together to do great work more effectively and more efficiently. And I think the beginnings of that are happening right up to this point. ONS did amazing work globally, and EONS did amazing work globally. And all of that, those things were happening. But imagine how magical it could really be for change as we start to come together to do that work in a really more thoughtful and strategic way.
I agree. The future looks bright. I'm so excited to hear about all of that and all the work that we'll continue to do. And finally, what advice would you give to an oncology nurse who's interested in getting involved with global oncology nursing?
I think I'm going to be really tactical with my advice. Be involved in the ONS community so you can see and hear from ONS National and from your peers what opportunities there are. Be comfortable navigating the volunteer portal so that when we are looking for global volunteers to do things, you see that and can apply. A lot of times those application windows are short. And make sure that you are opted in to get your weekly update from ONS. That will show you the whole list of volunteer opportunities, including the global ones that we have, as well as things that are closing soon. And then just last, if you're proficient in speaking another language, even if there's not an opportunity that you see posted, reach out to global@ons.org. Let us know that you're interested in being involved globally and that you are fluent in another language. Sometimes as we're triaging opportunities, if it does require a native speaker, that's something for us to be helpful to know as we're prioritizing triaging how we get involved in different things.
Thank you so much, Erica. I appreciate your time and all your insights into global oncology nursing.
Great. Thank you so much for having me.
As we conclude this episode, I'd like to thank Erica, Ashley, and Kristin, who joined us today for sharing their experiences and insights into global oncology work. I think it's clear that regardless of where we live, we all share the same passion for oncology nursing and in providing high-quality cancer care to individuals living with cancer.
Thank you for listening to the ONS podcast. Tell us about your favorite part in this episode by leaving a review wherever you download your podcast. For more resources and information about oncology nursing, visit us at ons.org and ons.org/voice. The ideas and opinions shared in this episode represent those of the guest and not necessarily ONS.